Okay, coming up next is one of our most awaited sessions of the day. It's the AI workshop. We all know how pervasive AI has become in our lives, and the medical field is no difference. So, we are bringing together 4 specialists who operate at the intersection of medicine and AI. And they are here today. Dr. Pradeep Kumar TJ, consultant physician and diabetologist at Medicover Hospital and Brookfield Hospital, Bengaluru. Dr. Alok Modi, consultant physician and diabetologist at Dr. Modi's Diabetes Center and Kevalia Hospital, Thane. Dr. Kumar TR, consultant physician and diabetologist at Kaveri Hospital, Bengaluru, and EC member of KRSSDI. Dr. Praveen Gangadhara, consultant physician and diabetologist at Dr. Mohan's Diabetes Care Center, Bengaluru. Sirs, over to you.
Good evening, one and all. So, I'm thankful to Disha team and the entire bunch of my friends who are here as part of this AI workshop. We would like to spend the next 1 hour updating all that we know and try to kindle a little more of excitement from each one of you on what are the current scenarios that we have for including AI in our general practice. 3 months ago, when I was actually in my clinical practice, I had multiple tabs that I used to open. One was for writing my lectures, one was for checking my facts, one was for summarizing my research paper, one was for creating a patient education materials, and one more was busy arguing with me on what I was actually doing was wrong. At this point, we realized something, that we were not using AI. AI was actually using us. Now today my goal is very simple. I'm not here to tell you which AI is best, because it's like asking which specialist is best. If you would ask a cardiologist to go ahead and conduct a delivery, if you would ask an orthopedic surgeon to go over and conduct a cataract surgery, similar to all the AI tools that we have, each one is best at what they do, and we need to choose the ones that are going to be effective for the task that we would want to perform. We also should be aware that each of them have got certain limitations, and we need to understand that we cannot completely rely on all that comes out from the tasks that you ask for. Now, do physicians need an AI tool as a strategy? As I just told you that not one tool can do all that we would want to do, we need to be aware of the various pitfalls that can occur whenever we pose certain questions, and we need to be aware of certain answers that can be hallucinating whenever we ask for certain questions. I would want to take you through some of the tools that we generally use. These are some, I'm sure everyone in the audience is someone who have used ChatGPT. The other ones that are there are the Claude, the Gemini, the Perplexity, and the Grok. ChatGPT, we all know, is best for drafting, brainstorming, and everyday productivity. Its core strength is multimodal, it's versatile, and it's got a huge plugin and a GPT ecosystem. If we have to look at Claude, it's best for deep reading, long documents, and nuanced writing. It has got limited token systems, and it's got a very balanced reasoning. Gemini, we know, it's interconnected because of all the various platforms that is integrated to, and it gives us the real-time data. Its strength is because of its native documents that is getting connected to our Gmails, to our spreadsheets, to our calendars. It's integrated, and it gives everything under one roof. Perplexity gives us verified cited informations and fact checking. And whenever we talk about perplexity, it is like getting into a research paper, and it gives you everything every time that it talks, there are references that are attached to it. And Grok is our social media friend who keeps in touch with the real-time social trends and the informal commentaries, and it's got a live connection to the X and social sentiments that are there going around. Now in the next few slides, I'm going to take you through live demos of what a chat GPT can do, where you can use it, what are the kind of responses that you will get, and where you shouldn't be using it. This is the clinical scenario where we wanted to talk about a patient education handout in a plain language for insulin counseling, and the prompt that I've given here is draft a plain language patient handout for a newly diagnosed type 2 diabetic starting on metformin 500 milligrams once daily. Please cover what is its dose, how to take it, what to watch for, and when to call the clinic. And keep it under 200 words, and also had a Hindi translation line at the end. Now this is how your chat GPT responds. It makes sure that it helps your body on how it uses insulin, how it helps better the blood sugars, how to take it, what to watch for, what are the signs and symptoms, and what it also does is, because it's fast, it's patient friendly, and it is customizable on commands. But you need to always ensure that you are the one who is going to hand out this patient to this patient after you have verified, vetted it, and you have seen that all that outcome that is there is extremely relevant to the outcome that you have desired. Where not to use it. This is the scenario requesting a treatment decision for a complex multimorbid patient. Imagine the prompt that you give for this patient, Mr. X, 64 years, type 2 diabetes, HbA1c 9.4, CKD stage 3, EGFR 46, compensated heart failure, ejection fraction 38, currently on metformin 1 milligram BD and glimepiride 2 mg/OD. Should I add empagliflozin or switch to insulin? If EMPA, what dose? Is metformin safe at EGFR? If this is the kind of a question that you would want to answer, I'm sure ChatGPT is not the platform to use, because of all the kind of hallucinations that you would get. You're going to assume certain things which are not what the ChatGPT already know. It doesn't have a prior idea of the patient's ECG, the echo report, the current medication that the patient is taking. Without all this, it will throw out some kind of an answer which may not be very appropriate for the kind of a question that you have asked. Now coming to Claude, imagine this is a clinical scenario. You want to ask for summarizing a lengthy discharge summary with clinical action points. This is a fantastic tool that you would be able to use. This is the prompt that I've given. A 3-page ICU discharge summary of type 2 diabetes patients post-STEMI, including echo, cath report, medications, reconciliations, and a 14-day inpatient course that we go through. The entire case sheet is uploaded into this. And here, the question is, list the top 5 metabolic findings in order of clinical priority. Flag any drug-drug or drug-drug disease interactions. Also suggest 3 specific questions to ask at the first post-discharge OPD visit. You can see how structured it is. What is it that you would want? And this is where Claude would give you the kind of a response that you see on the left-hand side of your slide. It tells you your HbA1c is fully under control, metformin, post-contrast cath, you shouldn't be using this because serum potassium is 3.1 at discharge on patient on fusinide. You need to make sure that you recheck your potassium at the time of when the patient is coming back for post of discharge. And these are some of the salient points that you will be able to get whenever you're using Claude in these situations. Again, situations where you cannot use it, it's like asking for guidelines that was released some time ago. The prompt is, what are the RSSDI 2025 updated recommendations on insulin initiation thresholds for type 2 diabetes, specifically the new HbA1c cutoff announced at the April 2025 consensus? Please note here that Claude is not the right tool here, because this is something that you would want to ask Perplexity, because that's the tool that gives you the latest updated document that will help you get all this latest guidelines and the guidance to using each of these guidelines. Now coming to Gemini. Uh, this is a fantastic tool because it's already integrated into all our social platforms. It is integrated with our Gmail, it is integrated with our calendar. This is something that you can use, for example, whenever you want to draft a letter for a referral letter to your colleague from another hospital. It will beautifully draft whatever that you would want to do and how you want to go about it. These are some of the examples on where you could use it and some places where you cannot use it. But one thing that you need to make sure is because of the DPDP Act 2023, you have to ensure that you mask the clear identifications of the patient, the name, age, sex, it needs to be blocked so that you are not sending this data into public domain and you can be in trouble in the days ahead. Perplexity is that tool that you can use whenever you're looking at research materials, whenever you would want to summarize a research paper. This is the tool that will give you exactly quoting all the past clinical trials that have been done and how you could probably go about using this. I'll take you through Grok. Alok is going to talk more about it and how he's going to use this. This is for people who are into making reels, social media, Twitters. These are some of those platforms where you would want to use Grok. Now, I've taken this case scenario where I presented a single prompt across all the various platforms that is available and how each one of them will be able to give according to their strengths. This is the case. Lakshmi, 62 years, type 2 diabetic, 14 years, established cardiovascular disease, CKD stage 2, newly prescribed tirzepatide, 2.5 milligrams. She has questions about the injections. Her cardiologist wanted a co-management letter. The clinic wants to post an awareness update and you needed to verify those dose titration. What Perplexity does to you is it verifies tirzepatide dose titration schedule along with the CV safety outcome evidence. Claude will give you the draft for the co-management letter to the cardiologist. The ChatGPT can give you a plain language patient FAQ questions to answer all the patient's questions. Gemini will insert a letter into the Google Doc and help you for the calendar follow-up for this particular patient. Grok will give you what is it that the patients are actually talking about tirzepatide in the general domain that is there. And that's how a single case scenario, you can use different tools to get different outcomes based on what is it that you would want. So what actually does each of these tools do is a specific output that you would want according to the kind of information that you would specifically require in each of these patients. Now, giving a single prompt across 5 different tools, you get 5 different answers. And here, the prompt that we have given is what is the current recommendation for HbA1c target in a 55-year-old patient. This is something that you will get here. You will have to know when you're using ChatGPT, you have to verify this. If you're using Claude, you have detailed description of all that you would want. Whenever you're using Perplexity, it gives you the best cited evidences that are available for it, and this is not a platform where you want to use Grok. This is one other slide that I want each one of you to take note of. These are 10 danger signals, when to stop and switch tools. If there are no citations for a clinical claim, you need to switch to Perplexity. Make sure that you always mask the patient's name, the MRN entry, so that it is an anonymized version that you get put into any of these tools for public consumption. The tools answer a question and it was not built to answer which is the right tool that you need to use. That is your intelligence that you need to use. An emoji heavy or informal clinical advice is a wrong tool that is to be used for clinical content. If you are about to copy an output directly into your patient record, you need to make sure that you're using every word, first edit it and then you need to use it. For dose recommendations and with some that comes out with a very high amount of false confidence, we need to use our discretion, verify it from the primary source before you actually adopt it. Make sure that you are able to train your data from your own systems on a regular basis so that it comes out in the way and fashion that you would want. Just a couple of days ago, I was using ChatGPT and asking it to kind of refine my CV. And what I found was, it mentioned to me that given the profile that you have and the expertise that you have done, I'm unhappy to just sign off by giving you only a resume. I would be happy to kind of write an autobiography that your grandchildren will be proud of. And that's the way it dictated to me 10 chapters about myself on what should go into it, what is the kind of a clinical expertise, what is the kind of a professional expertise, what skills that we had, what are the kind of associations that I belong to, what are the social services that you've gone to, and that's the amount of depth. And all this is from where? It is picked up from what we have already interacted with in the years that we've been using these tools. Now, your clinical AI decision tree, you need to answer one question at a time. First ask, what is it that you would want to use? Whether you want to craft, draft, or write, use ChatGPT. If you want to read or summarize a long document, use Claude. If you want to verify the evidence, you want to write a guideline or a drug data, use Perplexity. If you want to organize, schedule, and workplace tasks, use Gemini. Do not confuse your AI tools with all those questions that you would be asking in an anonymized version. The rule above all is no AI tool makes a final clinical decision. It is not one, it's never. These tools produce drafts, summaries, evidences, pointers, and communication aids. The prescription is yours. The treatment plan is yours. The relationship with the patient is yours. AI is the fastest, most knowledgeable and medical student you would have ever supervised, but you are always the consultant and the boss. This is some kind of an OPD workflow before and after. This is how it has helped me in my OPDs. It has reduced my using Gemini, where I am able to save by around 10 to 15 minutes by browsing through the documents, and it is able to give me a patient appropriate handout for according to the language that they would want by saving 15 minutes. By saving 20 minutes every time that I have to go into deep research and ask certain questions about some of those cases that I would want. Similarly, in each of these case scenarios, the kind of time that you can actually save for yourself, for your family, for your personality, you would definitely be enriched by using this. Now, this was an exercise that we wanted to do, but I'll skip this. Now, these are the golden rules for AI use in clinical practice. Always understand AI assists, it never decides. Every AI output is a draft. The final clinical judgment, prescription, and treatment plan always remains yours and yours alone. Never enter identifiable patient data into public tools. Cross-verify critical facts independently. Use a citation-first tool before quoting evidence. Stack the tools by its strength and not by the habit. And there is no favorite here. One tool per strength, one physician for every final decision. ChatGPT for creation, Claude for reading and reasoning, Gemini for organizing, Perplexity for verifying, and Grok for a trend watching. This is what I wanted to convey to each one of you, and I have my other friends who would be taking up the remaining part. I now welcome Dr. Haim